Hi, my name is Emanuel Cruz Carrasco. I'm going to read chapters 16 and 17 of the textbook Professional English Use in Medicine. Chapter 16 is Bones and chapter 17 is Childhood. I'm going to begin reading the theory of chapter 16 Bones. A. Bones. Some common English names for bones. English name skull. Anatomical name cranium. English name jawbone. Anatomical name mandible. English name spine. Anatomical name vertebral column. English name breastbone. Anatomical name sternum. English name rib. Anatomical name costa. English name collarbone. Anatomical name clavicle. English name shoulder blade. Anatomical name scapula. English name thigh bone. Anatomical name femur. English name kneecap. Anatomical name patella. English name shin bone. Anatomical name tibia. B. Fractures. A fracture is a break in a bone. Some of the different types of fracture. Here we have images of the different types of fractures. The video is mirrored, so sorry for that. We have the green stick fracture, the displaced fracture, the comminuted fracture, the impacted fracture, and the open or compound fracture. A pathological fracture is a fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma, for example, long distance marching or running. C. Treatment of fractures. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example a splint or plaster of Paris cast, or internal, for example a pin or a plate and screws. A displaced fracture which is not reduced may result in malunion, incomplete or incorrect union. Note, the verb reduce has several meanings in medicine. These meanings are to make smaller. I think we will better reduce the dose of your tablets. In surgery, to return to anatomical position. A hernia can normally be reduced by manipulation. In chemistry, to remove oxygen or hydrogen, nitric acid is a reducing agent. We have images of a plaster cast, a pin, a plate, and screws. Here we have. Again, sorry for the images and text being mirrored. So now I'm going to read the exercises of chapter 16 Bones. Chapter 16.1. Label the diagram using words from the box. Look at A opposite to help you. The words in the box are breastbone, collarbone, jawbone, kneecap, rib, shin bone, shoulder blade, skull, spine, thigh bone. Here we have the skeleton. Now I'm going to read again in order of where is indicated in the diagram of the skeleton the bones. Number 1, skull. Number 2, jawbone. Number 3, spine. Number 4, breastbone. Number 5, rib. Number 6, collarbone. Number Number 7, shoulder blade. Number 8, thigh bone. Number 9, kneecap. Number 10, shin bone. So those were the bones indicated in the diagram of the skeleton. Now I'm going to read exercise 16.2. Match the types of fracture 1 through 5 with the description A through E. Look at the opposite to help you. 1. Open. A. There is a break in the skin. 2. Communicate. C. The bone is broken into several pieces. 3. Displace. D. The broken pieces are separated. 4. Green stick. B. The bone is bent. It occurs mainly in children. 5. Impacted. E. The broken pieces are pushed together. 16.3. Complete the textbook extract. Look at C opposite to help you. 1. Union of fracture involves trying to return the bones to as near to the original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on to malunion. So that was chapter 16 of the textbook Professional English Using Medicine, Bones. Now I'm going to read the theory of chapter 17 of the textbook, Childhood. Chapter 17, Childhood. A. Milestones. Childhood is the period during which a person is a child. It ends with puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestone in a child's development and ages at which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months, talking 2-word sentences by 3 years. B. Common infectious diseases. Here we have the names of diseases and their common name, or the name usually used by people in normal or non-technical language or verbiage. Disease: morbilli/rubella. Common name: measles. Disease: rubella. Common name: German measles. Disease: varicella. Common name: chickenpox. Disease: infectious parotitis. Common name: mumps. Disease: pertussis. Common name: whooping cough. Disease: acute laryngotracheitis. Common name: croup. Disease: scarlatina. Common name: scarlet fever. Disease: rheumatic fever. Common name: rheumatic fever. Disease: tetanus. Common name: lockjaw. Disease: poliomyelitis. Common name: polio. C. Celiac disease. Celiac disease. A medical student has made some language notes while reading her textbook. First we're going to read the textbook extract and then we're going to read the notes of the student. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy it appears after weaning or to cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, or there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood. Now we are going to read the notes from the extract that the student made. Sensitivity to: having a negative reaction to. Meaning: weaning, changing the diet from milk only to solid foods. This is in infants. Clinical features: the symptoms and signs of a disease: malabsorption, poor absorption, malnutrition, poor diet, nutrition, adjective, malnourished, thrive, grow strongly, distension, swelling, delay, later than expected, failure, when something that is expected does not happen, stature, size, especially height. Now I am going to read the exercises of chapter 17 of the textbook, Childhood. 17.1. Complete the table with words from A and C opposite. Then complete the sentences with words from the table. Here we have the verb, the nouns, and adjectives. Verb, delay, noun, delay, adjective, delayed. Verb, develop, noun, development, adjective, develop. Verb, distend, noun, distend, adjective, distended. Verb, fail, noun, fail, adjective, failed. Verb, nourish, noun, nourishment, adjective, nourished. Okay, so now I'm going to read the sentences that include the verbs, nouns, and adjectives. Here we have them. 1. Babies with the fetal alcohol syndrome may present with failure to thrive. 2. Abdominal distend may be due to a large liver. 3. Small amounts of alcohol in pregnancy can affect fetal development. 4. Mortality from measles can be reduced by better nourishment. 5. Delay in one or more of the milestones may be the first sign of disease. 17.2. Complete the sentences. Look at A and C opposite to help you. 1. After sitting, babies learn to crawl and then to walk. 2. A child who has started eating solid food has been weaning. 3. Someone who is not very tall is said to be of short stature. 4. The stages in a child's development are known as the milestones. 5. A child who is beginning to develop sexually has reached puberty. 17.3. Write the common English name for each disease using your medical knowledge. 1. Enlarged parotid glands. This disease is mumps. 2. Difficulty opening the mouth. The common name of this disease is lockjaw. 3. Rash on a large posterior occipital nose. This disease is German measles. 4. Paroxysmal cough with vomiting. This disease is whooping cough. 5. Papules and vesicles first on trunk. This disease is chickenpox. 6. Cough and cold followed by rash. This disease is measles. 7. Sore throat and rash. This disease is scarlet fever. 8. Swollen joints and a hard murmur. This disease is rheumatic fever. 9. Fever followed by muscle weakness. This disease common name is polio. 10. Cow with stridor. The name of this disease is crop. So those were the exercises of chapter 17, Childhood. Thank you very much for watching this video, reading the theory and exercises of chapter 16, Bones, and chapter 17, Childhood. Thank you very much for watching this video. My name is Emmanuel Cruz Carrasco. So that's the video.